I am here from the research end of our clinic at the Penn State Hershey ALS Clinic and Research Center. And our clinic is a collaboration between the Penn State College of Medicine and the ALS Association Greater Philadelphia chapter. One thing that I really love about my job and where I work is that we've worked really hard to bridge the gap between research and clinical practice at our clinic at Hershey. And we actually, a couple years ago, intentionally changed the name of our clinic to the Penn State Hershey ALS Clinic and Research Center in order to acknowledge that collaboration that we have. So this presentation comes from us identifying a need in our clinic around patient education. Our clinic at Hershey sees about 200 patients a year. Our clinics are mornings and afternoon sessions, which are about 4 hours in duration for each patient. And patients return to our clinic around every 3 months. So we saw a need. A lot of clinic time is spent around teaching patient care skills. So our occupational therapists, physical therapists, respiratory and speech therapists are very often teaching the patient and caregiver new skills. And we saw that these one-time lessons that are occurring maybe in a 15-minute duration every 3 months were insufficient amounts of time for our patients to retain those lessons, those skilled lessons. So we performed a needs assessment, and this was done with our Philadelphia chapter of the ALS Association to see whether the internet might be a potential learning opportunity for our patients to learn about care techniques. Our ALS Association sent out a survey to all registered patients who we had email access for, asking them about their thoughts about using the internet. We saw that our patients are using the internet to look for information about ALS, and they're engaging with the internet from several times a day to less frequently at a couple times a month. And where they go to find their information about ALS was our Greater Philadelphia ALS chapter webpage and also the National ALS Organization, and less frequently at other organizational websites. We asked survey respondents whether they thought instructional videos might be helpful, and overwhelmingly they said yes. And we gave a variety of topics in several different themes: physical, bulbar symptom management, and respiratory management. And we asked our respondents to rank order those topics in order of preference in terms of what would be helpful for them in terms of a video. So I'm showing here our physical domains, and we looked at range of motion, falls assistance, safe transfers, and using a patient lift. And range of motion turned out to be the top preferred video topic. We decided to film 3 patient care videos, including range of motion in the upper extremities, the lower extremities, and how to transfer a patient from a wheelchair. We were fortunate enough to have a physical therapy student approach us wanting to complete a summer project, and so we used this opportunity to have the student develop scripts for videos. They were reviewed by our therapists in clinic for content. And then we filmed these videos over the summer using a volunteer patient and caregiver to demonstrate these patient care skills. The videos were posted to our chapter webpage, to our chapter's YouTube channel, and we also did a Facebook posting. We are also using these videos in our clinic. If our therapists are teaching a skill, when we provide our recommendations at the end of clinic, we provide our patients with a link to that video so that they can view it afterwards. One thing that we do in our clinic with all new activities is we perform a needs assessment, we develop an intervention, and then there's some sort of research or evaluative component. So we knew that these videos did need an evaluation. We were receiving good feedback from patients in clinic who are using the videos, but we understood that there are other viewers out there and we wanted to learn something about them. So I saw on our YouTube channel that there is a function called YouTube Analytics, and it's a way that you can look at who's viewing your videos, what are their demographics, how long are you retaining your viewers for a video, and where is the traffic coming from. So I looked at one video, which I'm going to show you the data for today, which is the passive range of motion on the upper extremities. All three of our videos had the same structure. They involve our physical therapy student giving instruction on exercises and demonstrating the exercise, and then our caregiver repeats the exercise. So I was very happy to see that the passive range of motion video was the top 2 most watched video produced by our chapter. Our chapter actually has hundreds of videos posted to the web, to their YouTube channel, and that is, especially with the Ice Bucket Challenge, we were posting 10, 15, 20 videos a day. So the passive range of motion has consistently been our top 2 video. I was able to look at who's viewing our video and where do they come from. So I was surprised to see that viewers represented 70 different countries. This is probably too small for you to see, but I'm able to look at all of the different countries that viewed the video, how many views there were per country, and how long people from that country viewed the video. So 72% of the viewers were from the United States, but other high viewer countries was Canada, the United Kingdom, and some Asian countries. I was able to look at the United States, and our intention when we made these videos was that they were going to be for the patients in our ALS clinic in Hershey, Pennsylvania, and also patients that are served by our chapter, which is the Greater Philadelphia chapter. And I was very happy to see that we were getting high views from other states. These darkened regions are where there's more people viewing the video. So Florida, Texas, and California, and New York State were all somehow finding our video. And actually, Pennsylvania only represents 13% of the people who have viewed this video. And the video was seen by 49 different states, and I wanted to see who was missing, and it was Idaho. I can also look and see how long people are watching the video by country. And in North America, a lot of European countries and Australia, they appear to be watching the video for a longer duration. So the video is actually about 6 minutes long, and on average, people are watching it for 2 minutes and 43 seconds. I'm able to look at the total lifetime history of this video. So we posted it in August of 2013, and I ended my data analysis in October. But consistently over the lifetime of the video, people are on average watching this for 2 minutes and 43 seconds, which is 41% of video time. I can play the video with YouTube Analytics and see where the viewership is dropping off. So I was interested at what happens at 2 minutes and 43 seconds. And what happens at 2 minutes and 43 seconds is the physical therapist has been able to demonstrate 3 range of motion exercises in the upper extremities. What happens in the remaining part of the video is the caregiver is repeating all of the exercise. So this was a positive finding for me, knowing that most of the people that are watching the video are getting the majority of the content. So where are the traffic sources coming from this video? The first traffic source is people actually searching YouTube for a video in range of motion. Secondly, YouTube is suggesting that you should watch this video. And then there was some unknown traffic sources. I was interested to see what are the search terms that people are using to find our video. And passive range of motion was the #1 search term, followed by other very related terms. So this was a good finding for me that we have titled our video appropriately, and people are able to find it using good search terms. Where are people watching this video? 95% of the viewers are finding it through the YouTube watch page. And a smaller number, but I thought was very important, are finding the video from an embedded web page on other websites. I was interested in learning about what those other websites were, and the first website that came up was surprising to me. It was a website called advancedweb.com, and I didn't know what that was, so I went and looked. And advancedweb.com is an organization for allied healthcare professionals. They had an occupational therapy section, and they had embedded all 3 of our videos to their website. So this tells me that not only are patients and caregivers accessing the videos, but this was also apparently helpful for therapists as well. The ALS Philadelphia embedded webpage only got 65 views, and that's probably the efforts of our clinic directing patients to that link. And surprisingly, Facebook only got 5 views. So we have a very active Facebook web page, and although the videos were posted to Facebook, only 5 people actually watched them. What are people using to watch the videos? 65% are watching the videos through computers, followed by mobile phones and tablets. It was interesting to me that the people who are watching the videos on tablets are watching a longer duration. So I wondered who those people might be. Maybe those are the therapists that are using it as a learning tool in the clinic. I'm not sure. So in conclusion, this was a very helpful exercise for us. Video appears to be a very good way to present patient care techniques, and it's in a way that's controlled by the user, so they can determine how much they want to watch, when they want to watch those techniques. We're very happy to see that YouTube has the ability to send information to a very wide geographic region. And in the future, we're going to think about a broader audience for our videos beyond just thinking that they might be useful for people in Hershey, Pennsylvania, or our chapter. And we think that a length time of 3 minutes or less might be most appropriate. This has encouraged us to pursue other videos. We have several other topics that we would like to create videos for. And this also showed us that there's opportunities for collaboration with other organizations. So we could be reaching out to maybe hospice organizations or other allied professional organizations sharing our tools, and they would be useful for that population. So I just wanted to say thank you. The video, if you need a direct link, it's at our chapter webpage at www.alsphiladelphia.org. And I'm here with my colleague Susan Walsh, who is our nurse manager. And if anyone has any clinical questions, I might ask her to respond to them. Thank you.
Thank you, Beth. Okay, do we have questions for Beth from that presentation? You've gone shy again. Okay, one in the middle, Rachel. If you could stand. Thanks.
So Rachel from Dublin. I'm a physiotherapist as well. And just, in terms of your very good presentation, first of all, but, with the passive range of motion for the upper extremity, do you give any warnings or anything like that in the videos that possibly it doesn't suit every patient? I suppose considering that there's a high percentage of, shoulder pain in this population, that, it may not be suitable for every patient. So you have to take some sort of do you give any warnings, I suppose, or?
She is definitely giving positional tips and a few warnings, but they are very brief. I mean, she gets through 5 exercises in about 3 minutes.
Thank you. Elsewhere? Okay, I've got one at the very back.
Hi, I'm Philippa Revi from Edinburgh. I really like the idea of using YouTube videos for helping with patient management. I just wonder whether you've actually measured the impact on patient management. I mean, obviously not worldwide, but perhaps with the patients in your clinic.
We have not. This is sort of our first take analysis on the videos. We talked a lot about how we would evaluate the videos, and we have gotten some feedback from our patients in clinic, and then we thought just looking at outreach was the first thing that we would do.
Thank you. And elsewhere? No? Okay, so can we thank Beth then for her presentation this morning?